We as estheticians treat men. We can help at the beginning of diagnosis, right before they start treatment, and then right after. And you have to be careful between 1 and 5 years after treatment because it's a very sensitive time. So you really have to understand the diagnosis and the client and what's needed.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, what are we talking about today? Something maybe focused on you and me, or maybe broadly men?
Yeah, I think today we want to focus on skin and the skin of men specifically. You know, a lot of times we see in the advertisement world, a lot of focus on female skin point of view. And it's good to remember the guys, right? Because also we come with skin, just delivered just like that. But also we have some special needs. And also, I think today we want to focus on a specific population. Those are men who may undergo treatment for various cancers and the skin toxicities that follow that. So we wanted to bring a different point of view this time. As opposed to bringing a doctor, we want to bring someone who actually deals on a day-to-day with the skin problems of his clients. Shall we introduce our mystery guest?
Yeah, well, our mystery guest is not such a mystery. Lachelle Yulee was with us on the podcast earlier, and we had an awesome conversation. Hadar, I think you missed that one, but now we've got the whole gang together, so this was meant to be. He is a licensed esthetician. He's also a men's skin health expert, practices in Beverly Hills. He's had a 20-plus year career working with all kinds of cosmetics and product development companies. You name it, Neiman Marcus, Chanel, Saint Laurent. And not only that, he's also really focused in on understanding the nuances of skin. Lachelle, you tell it to us the best. Why don't you just welcome yourself to the podcast?
Well, yeah, thank you guys very much. As you've mentioned, I was here before, and basically I fashioned myself as a men's skin health expert in becoming that. I really focus on skin issues that are relative to men and try to find ways to sort of talk about those things, educate, and treat in my treatment room. So yeah, that's me. Today, I will be talking about providing treatment to men of color living with cancer.
Well, Lachelle, before you get into that, let me ask you, because, there is such a conversation around, and this is not just, in the esthetician space. I mean, look at dermatology globally or even the beauty market. A lot of it had been, and I do want to use the word had been women, but now it's, with the emergence of things like Botox and, I have a lot of clients now that are coming in, a lot of patients that are asking for either aesthetic procedures or like really trying to take care of their skin better. There's been this unwrapping of this. I don't know if it used to be a weird thing for men to focus on this, but now I'm seeing a lot more men asking about it, leaning into it. What's changed there, Lachelle, and what got you into this space?
Well, what got me into this space was I saw a deficit. Obviously, you just mentioned we are the minority in this industry on both ends, coming into the treatment rooms, which is changing, and also as practitioners, which is changing. So, what got me into this was my own personal journey with self care and how I've seen it help elevate and change my life in a good way, both being working in the industry and then getting services done. And what I'm starting to see with men are starting to take pride in themselves aesthetically. And more importantly, they're starting to turn the corner around the wellness and health industry in terms of looking good and feeling good and combining the two. And so I think with, in the past, I would say 4 years, especially from pandemic on, we estheticians have become essential. People don't realize that. Like, we have become essential. And because of what has been going on just in the world, people were looking for ways, especially men were looking for ways to find ways to sort of self reflect and take care of themselves and feel and look better and do better, right? And think better and be better. And so I think this aesthetics and coming into the treatment room is just a part of the tools. They're starting to understand that it could be part of their tools to put into the toolbox of wellness.
Let me jump into something that you just said there, because I think this is profound, and it's something that even I totally missed the boat when I initially was learning about aesthetics. When I first thought about aesthetics, I thought, okay, it's about beautifying the skin or it's about skin care, but it's about self reflection, isn't it, Lachelle? There's a lot of self reflection that goes on in that room. There's a lot of like downtime where you actually get to pause and think. And can you speak to that? And can you also speak to a second thing that may be related? How many men are estheticians? I don't feel like there's a lot of men in aesthetics. And how do you think that that's shifted? And then also, can you speak to the self-reflection piece?
Okay, so I'll start with the self reflection, please. I think there is tons of self reflection. I mean, from the consult on down to the actual treatment itself, right? You're dealing with one on one, you're being asked certain very important questions about lifestyle, and that also gauges a certain conversation within yourself. And then when you begin the treatment, especially if it's something like more focused, if we're to try to heal a certain skin condition, the questions get more in depth. And so, in the diagnosis piece and having men commit to the treatment, there's constant consistency that they have to do within themselves outside of the treatment room, which forces them in some ways to sort of connect with themselves in, just like I mentioned before, and our last time we talked, in the home care piece. But just as a practitioner, between the practitioner and the client alone, in that space, relaxation, therapeutic touch, there's a piece of meditation. There's a little bit of spiritual reflection in there too, because there's a slowing down and stillness piece that some men mainly don't get. So there's so many different variables that go into having a treatment done, right? That's more past relaxation. In terms of how many men are in the industry, I can't say numbers specifically, but what I can say is there is more men than you would think. We just don't have the biggest of visibility as the women do, especially with working with certain skincare companies or being in positions of influence in the industry. But there's tons. I'm actually part of a couple of different male chat groups. I'm floored still that how many male estheticians are in the industry and are continually to grow. But there's a lot more than has been in the past 2 years, and there's more coming. So
That's wonderful. Well, Lachelle, with this kind of background, I want to move now to talk about men who live with skin cancer and the toxicities of the treatment. And can you elaborate what kind of conditions walk through the doors of your practice and what do you see on the day to day? And then maybe even before that, touch a little bit, why did you even want to focus on that? It seems a very specific niche.
well, when I first got into doing skin treatments, I liked doing facials. They were fun, but I really felt that this work is more meaningful to people. That's why it's such a sensitive topic, right? To get facials, the idea of thinking about it and questioning people. And I said, I know that we do a healing of some sort. We heal skin health, and we also, it's emotional healing. And so a friend of mine who's actually working with me at the time had said to me, I think you should look up oncology skincare, which was fairly still kind of new. It'd been around a little under 10 years. And about 7 years ago, I just started to get training on that. And it was just a very small group of estheticians, but more massage therapists. And when I started to do the research, I did not realize how cancer really affected the skin. And so when I was talking to certain clients in certain organizations that I was working with, I worked with Cancer Support LA, Tower Cancer Research Center. I worked with Cedar Sinai here and there doing little things. And I realized that a lot of the post care was a lot of the clients trying to heal some of the skin toxicities caused by the cancer treatments. And I realized that, wow, a lot of us as estheticians don't really know this, and we don't know how to treat this. And there are doctors who would give recommendations on skincare that actually was counterproductive to the actual cancer itself. Like a lot of dryness and dehydration that comes up, a lot of doctors were kind of offering them, hey, why don't you put petroleum jelly or neosporin, and just to kind of help them through some of those issues. But they didn't really quite understand the ingredients that we understand as aesthetics to help really nurture the skin. So I just kind of doubled down on, wow, this is really something that can be beneficial to people in the healthcare world, and how can I align myself with these health professionals to sort of help educate and be a part of the client's continuum care. So it just became something that I felt was needed and very beneficial on a level that speaks past pampering.
Yeah, no, that sounds quite amazing and definitely a journey seeing and sharing time with men who go through this very difficult time. Can you, and you mentioned a little bit about skin dryness, can you mention, just so our listeners can wrap their head around what is happening in the treatment room, what kind of conditions do you see that really require attention and maybe where you feel the sweet spot is? So, where you are actually feel like you're making a difference.
Well, let's talk about some of the unique challenges that men face around healthcare in general first, right?
Sounds good.
There's cultural stigmas around our invincibility and us going to see a doctor. Some of us don't really do that. I've mentioned that before in our first talk. There's societal pressures, expectations of masculinity, of healthcare. We have to be stoic and we have to be strong. I mentioned that. And then there's also, especially in the sector of men of color, there's historical and ongoing disparities in healthcare, right? So there's a distrust of it. So going to get that information, and also after you've gotten the information, the post care to continue it is something that most men kind of dismiss. And so those are one of the things that I really see. And so I felt that, you know, most men, like I said, they will go get their hair cut before they go to a doctor. And I felt like, well, they would feel comfortable coming to an esthetician. Like I also, when I'm doing just clients who are not living with cancer, I look for things where I have to say to them, if I notice certain spots or issues on the skin, I'll say, hey, have you seen a dermatologist? Have you seen a doctor? Right. So using that in reverse, to come after they've seen a doctor and have gotten this diagnosis, they feel more comfortable in being more proactive about any skincare issues that they may face because of the treatments of cancer. And basically, that's what I'm talking about and educating people on. It's not the cancer. It's the cancer itself does something on the skin because there's so many different types of cancers, but there's specific cancers to men that really stick out. And these are not always skin cancers. And it's myeloma, prostate, colorectal cancer, lung cancer, renal cancer. It's the treatments of radiation, chemotherapy, integrative medicines. Those are the things that causes skin toxicities on the skin. So those are the things that I see. Now, men of color, the information on how those things show up on our skin is very different. And you don't really find a lot of research on it. And you can't really identify it. And I wanted to make it a thing to educate, especially other practitioners, how to really address those issues.
So, Lachelle, what are some of the things that you see, and what are the differences that you see in darker skin tones?
Well, the difference is you'll get the same things. You'll get like skin chemo rash, and you'll get things like from wounds, like from, big certain incisions being done, scarring, things of that nature, inflammation, things of that nature, dryness, dehydration. It just shows up very differently on our skin. Sometimes you can't really tell on someone from a Fitzpatrick who's, let's just say, darker Latino, Middle Eastern to Black. The rash may not look as prominent as it does on a whiter skin tone, right? And so sometimes it doesn't feel like it's as detrimental, or it needs addressing. So these are some of the things that I get to see. Or in reverse, when we do have somebody who has gotten certain incisions done or certain things removed, the hyperpigmentation is a little bit deeper, and the wound takes a little longer because of the skin tissue itself being what it is for a darker skin tone. And so I get to see those things in the room and get to know how to treat them. Now, when you are treating them, you have to take into consideration, obviously, really take into consideration ingredients and as a process with dealing with anyone with cancer, but especially with darker skin tones, because you don't want to exacerbate any pigmentation. You don't want to exacerbate any more toxicity or injuries to someone who's gotten some lymph nodes removed or incisions or any sort of surgeries done to them.
Well, let me ask you about that because I think you bring up a good point. Redness is definitely one that's harder to see. Sometimes, even as the redness is resolving, it's a little bit tougher to see the redness as it's fading. How do you approach, say you have two people that are in as clients and you have one that's, a little bit darker tone, maybe like, my skin type, I guess I am a Fitzpatrick 5 or, maybe Fitzpatrick 4, 5, 6 versus say like a 1, 2. How would you approach sensitive skin, for example? Because I know with chemotherapy you can sometimes get this sensitive skin. The skin becomes very sensitized, dry, easily irritates. How are you counseling them differently, or what kind of approaches might you take differently?
Well, first of all, when you bring skin sensitivities into this particular arena about skin cancers, especially if you're seeing them on a continuum basis, you have to always start off with what new medications are you taking, because it's not just the actual therapies that they went through to cure or diminish the actual cancer, but it's now those medicines to sort of continue to treat. And sometimes when they're taking new medications or when they're on certain medications, their skin changes. And sometimes that redness and those sensitivities that show up are the medications at work. You have to ask those questions and know to ask those questions and be familiar as best as you can with the continuing cancer treatments, especially if they're doing home oral things like that, and how they show up on the skin. So that's how I initially start off with, right? And from an aesthetics point of view, it's always how do I calm and soothe that sensitivity, inflammation, right? Or that wound. And that's usually a great indicator of how I can modify what ingredients I use, or even if I'm bringing in a certain modality. Sometimes I can use RF on certain things for like lymphatic drainage or LED lights for healing. So it's about really checking in. I'm checking in with them each visit and being very familiar with some of the medications that they're on, or some of the medications that they went through. And that usually helps me sort of navigate the treatment.
Thank you, Lachelle. That was very good. I'm actually sitting here and thinking how when men undergo treatment for cancer, you really nicely reviewed that whole issue of men need to be invincible and it's really hard. And a few reflections came to mind. I mean, I know a lot of men come to my practice and say, oh, my barber said I should look at this, or my partner said somebody should look at that. And it's always someone else told them because it may not be so cool to seek care yourself. Although, as Raja mentioned earlier, I think this is more and more changing, and men are becoming more comfortable in the skin, in their own skin. No pun intended. Well, maybe it is intended. The other thing I thought was really interesting is the idea when you are sick in general, but I think especially with cancer, you have something that's brewing inside you, and you can't really see it. You may feel bad periodically. I mean, there was definitely that initial incident that led you to the doctor, and maybe that's a little better now. Maybe it was a cough that led you there or something else, but you can't
Mhm.
really see it. And when you start getting the treatment, you actually feel worse, at least in the beginning, until you get better. And it's almost like the outside for the first time allows you to look in the mirror and see that you're sick. And can you speak to that emotional journey that you may see in your clients? And because I think this is where really you can make a big difference, where we necessarily don't have time in clinic to go over this, or don't even have the training sometimes to perform some of the treatments that you're doing. I think it's really interesting and a really nice point of to augment whatever else is happening in their healthcare.
For sure. So a lot of things that I do address also is the psychological aspect of cancer and how it affects especially men, and especially men of color, but all men, of course, because it's very different for men of color and other men too, because their stigmas are really deeply rooted in the distrust and barriers and finances and things like that when it comes to healthcare. But to answer your question, once the diagnosis is hit, here's the thing, and I mentioned this just about skincare on its own. Most men are not coming to you unless something is, and they're not coming to you continually unless they really feel like they have something they need to fix. Now, once they get a diagnosis like cancer, that's when the light goes on that maybe they should do some inventory on everything in their lives, and especially about how they're taking care of themselves. So what we get to do in the treatment room is bring a nurturing aspect to it. So some of the things we get to do just overall in our practice is help the nervous system relax. That's where the pampering piece comes in at, right? And we're dealing with the anxieties around the diagnosis, and we're dealing with any fatigue that may come from some of the medications. And let me just also, and the treatments, and let me just also add this too. I always suggest that we as estheticians treat men. We can help at the beginning of diagnosis, right before they start treatment, and then right after. And you have to be careful between 1 and 5 years after treatment because it's a very sensitive time. So you really have to understand the diagnosis and the client and what's needed. But what we get to do in that room once we have that framework and understanding of what I just mentioned, it allows us to bring in our sort of integrative knowledge, right? And so we get to do things through, like, say, for instance, for dealing with fatigue or anxiety, you can do like Reiki, or you can do little things like acupressure holds, meditative things. You could bring sound bath pieces into the treatment room. This all deals with the psychological aspect or just the feeling of isolation, because the isolation comes when people are diagnosed too, and they feel sort of like, very scared to be around family and friends and feel kind of ostracized. And so we get to sort of reinforce the healing touch to deal with that piece. And I hope I answered that for you a little bit.
Oh yes, absolutely. And I think that it's really fascinating to hear you talk about this because I really feel there's a big need there that is really unmet. And so thank you for doing what you do. And for those who are in the LA area, where can they find you?
Well, I'm 338 North Cannon Drive in Beverly Hills, right in the heart of Beverly Hills. And so you can find me right there, or you can just go to my website, LachelleYuli.com, and then, it will lead you right towards me.
Now, Lachelle, as we kind of close out the podcast, I do want to ask you some of your opinions on some of your favorites. And one of the things that I like to think about is all these ingredients that we have available and, all of the opportunities that we have to maybe, treat the skin. So from that standpoint, can you give us, and I know this is kind of maybe too broad reaching, but what are your top three ingredients that you like to consider in people when you're seeing them? Or do you have like a top three or maybe like three favorite ingredients that you always have in your tool chest?
Always, 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 always have hyaluronic acid. I just think it's just like a wonder ingredient because everybody can use some hyaluronic into them and in their in their skincare routine. We have it in our bodies. I would say that people who have been through cancer treatments, especially at a high dose or a really medical grade version of hyaluronic, if you're going to infuse it into the skin wound, that is something that you should. I always have them talk with their doctors first because they can have an adverse reaction to them. But another thing I like to use lately, especially when dealing with cancer, is stem cells. I absolutely love it, especially around wound healing. It's been fantastic in the practice for me to actually.
Now, how does that work, Lachelle? Like, do you put the stem cells on, or is it a stem cell extract, or is it because there's also fruit or plant stem cells that are used as ingredients? What kind are
So I
you?
use stem cells as plant-based stem cells right now. I do have one that is plant-based stem cells, and I have external growth factors as well too, that I like for this particular sector of my treatments. And yes, I do it as a topical treatment, and I can infuse it a different couple of ways. I use a nanotech pen sometimes, depending on how sensitive the wound is. I can infuse it like through my oxygen gun. It's just ways that I know how to do that using certain types of other like transition products like toners to kind of like soften it down so that I can infuse into the skin, or just classic hand movements, because once again we're wanting to put our hands onto these particular types of clients because it's all about therapeutic touch. And I've also started using um, a lot of essential oils.
Mm.
really, really good. But you have to be very careful. Some people who are dealing with cancer or living with cancer, have been through it, are very sensitive to that too. So
Right,
be
they have sensitive skin,
very
right?
sensitive.
Yeah.
And it's how you use it. You don't want to use it direct from the bottle onto the skin. You want to have sort of a buffer product to use it. But I
What do
found
you like to use there, Lachelle? Is that a carrier oil or do you use something else?
I use a carrier oil. I have a carrier oil that I use. Actually, I have it pre-mixed. I work with an organization called Look Feel Fab Cancer
Mm.
Organization, and they're a group of estheticians, and we use a carrier oil, and we use a mixture, a blend of botanical essential oils that I absolutely, absolutely love.
So I love it. So hyaluronic acid,
Yeah,
plant stem cells, which plant stem cells really are interesting. Sometimes it's the extract, but somehow the feeling is they may be more enriched in certain phytochemicals. And
yeah,
then you've got the essential oils, which kind of a broad brush, but you probably have some favorites. But I think the takeaway was don't put it directly on the skin,
yeah,
do it right. So for all of you that are figuring out how to do it right, find Lachelle.
yeah.
It's not hard. Beverly Hills in Southern California. Lachelle, Yuli, we really appreciate you spending time with us on the podcast today. It's always an educational session for me, and I'm sure Hadar feels the same way and appreciate all of the education you gave us again.
Well, yeah, so I will be seeing you guys at the symposium, and I'm really excited about
Yes, that's
it.
right. Now, couldn't have been a better segue. So, for all of you that are estheticians and want to join us at the Integrative Esthetician track during the Integrative Dermatology Symposium, or if you want to come to the Integrative Dermatology Symposium, we are talking nutrition as the main theme, but we're going to be covering all kinds of stuff.
Yeah.
Integrative just means anything and everything. And it's October 27th through the 29th. We're going to be in Reno, Nevada. We are going to be on a resort, and it is going to be a ton of fun. So thanks for reminding us about
You're
that
very
too.
welcome. I'll give more specifics on those ingredients a little bit in my conversation, so that it won't be, so people can understand, because when you're talking about essential oils, you have to be very careful.
Yes, and come see us there. I know, Lachelle, you're doing some educational sessions too, so we are super excited to have you on
Very
board.
excited. Thank you. I'm excited.
Thank you.
Thank you so much for supporting us through the last several seasons. We love receiving your questions on social media. And now, you can call them in as well.
Yeah, exactly. So if you're a licensed medical practitioner, call us at 424-309-8757 and leave a detailed recording with your name, location, clinical question, and it may just be chosen to be answered live on the next podcast.
We look forward to your submissions. And as always, stay curious.